The saddest part of it all is, of all the patients that come with malnutrition for these major operations, only 1 in 5, less than 20%, are getting these simple, straightforward interventions that A, are inexpensive, and B, are highly effective. And how effective are they? Well, we know, for instance, that if you treat a patient coming for a major GI surgery with a formula that contains some arginine in particular, and perhaps some fish oil in addition, along with some other protein content, you can reduce the risk of infection by 40% with just 5 days of treatment before the operation. 5 days. Not 5 weeks, not 5 months, 5 days. 40% reduction, and this is in thousands of patients studied. These studies are in good journals. They're in a wide group of patients. And this effect, this benefit, actually doesn't depend on the patient being malnourished. This data is the same whether the patient's well-nourished or malnourished. So our bodies have evolved a mechanism by which when we get injured, whether it's a tiger that bites us or a surgeon that hits us, about 3 days after that surgery or that trauma, our immune cells begin to deplete arginine in our spleen and lymph nodes to keep our own immune system from attacking us and possibly injuring us further. But that's, of course, from many, many years ago, where if you didn't get up off the ground and start eating again after 3 days after the tiger bit you, you didn't live. Well, now, of course, after 3 days, we don't want your body to shut down your immune system, and we obviously want you to live more than 3 days. And so by giving back arginine, we can prevent this arginine depleting effect that all of us as humans have, and improve immune response to infection and prevent infections dramatically, like I said, by 40% with this simple intervention. And so just by giving arginine for 5 days before, or if, let's say, it's a surgery we don't have a lot of time to prepare for, like an emergent surgery, you can give the arginine and fish oil after the surgery and get the same benefit. So it works if you give it before and after, or just after. And so that's why this is one of the essential components of the Mend, Repair, and Recover product that we wanted to be sure was in the right amounts that have been studied, that could easily be administered and utilized by surgeons and patients to optimize their recovery.